What equipment can you expect or need when getting towards the end of life? In this video, I'm going to talk about all the equipment you could get while on hospice, and or if not on hospice but getting towards the end of your life, what equipment you may need. On hospice, equipment is provided. It's called DME, durable medical equipment. Usually most hospice companies are going to use an outside company to supply their DME equipment. Now, it's important to know that all of this will be free. This is at no cost to you, and Medicare will be paying for it. So what can you get on hospice, and what's the most important things, I think? So you can get oxygen while on hospice. This is considered DME. You can get a hospital bed. You can get a wheelchair. You can get a walker. You can get a bedside commode. You can get a Hoover Lift. And I'll explain what all of these things are and how you can use them. There are other equipment you can get, but those are the things we typically see most of the time. Hospital beds, let me tell you. No one ever wants to get the hospital bed, or they always try to put it off. I, as the hospice nurse, always try to educate about how much it's going to be needed. I get that people want to be in their regular bed, and yes, they can stay in their regular bed as long as they can, but it is a safety issue, not only for the patient, but for their loved ones, because their loved ones are going to be turning and changing and doing things for this person that it's really hard to do in a regular bed. Hence why hospital beds are so important and so helpful. So I always try to urge patients and their families to get the hospital bed. You can easily get the equipment. So upon admission, I'm the admission nurse usually, so you can order it then. Or if you don't want to order it right then, you can always wait until the next nursing visit, or you can always just call the hospice company and say, hey, I'm ready for the equipment now, can you put the order in? Anyone can put the order in, and you can get the equipment pretty quickly, depending, of course, on the DME company, which I'll talk about that later in the video. So the hospital bed. The hospital bed's usually fully electric, so it'll go up and down using a little remote, and the head of the bed can usually go up and down, which is why it helps and makes things so much easier, because you can adjust the bed up to help preserve your back if you're the one, rolling and changing the patient. And then of course, it's always important to put the bed all the way down before you leave the room to keep the patient safe. The bed will usually have 2 full-size railings as well that will come up on the bed to keep the patient in the bed and keep them safe. It's also a great way to help them utilize and help you when turning and changing, because they can roll over, grab the rail, and help you push and pull if they have the strength. Some people will and some people won't. Usually towards the very, very end of life, they will not have the ability to do that, but oftentimes they can help for a while. So there's usually a standardized bed. It's a twin size bed, full rails, electric going up and down, and the head going up and down. The mattress is standard. We are not allowed to order a specific mattress unless someone already has a wound, and it's usually after a stage 2. So we can't just order an airflow mattress just because someone may have a risk of breaking down their skin. They have to have broken down skin, and then we can order the airflow mattress. However, there are other mattresses like an APP mattress or a waffle mattress that we can order to put on the standard mattress just to make it a little softer and to protect the skin a little more. Bedside commodes. Mwah. I love bedside commodes. Again, people don't like it, and I understand. They want to go to the bathroom in the bathroom where they're used to going. But sometimes that is impossible. There's too much exertion happening when they have to walk to the bathroom. So a bedside commode is a safe way that they can still go to the bathroom so they don't have to go in briefs, but not have to walk all the way to the bathroom. I'll put a picture on the side here. The legs are adjustable. So you always want the legs to be adjusted up so the person doesn't have to, I'm gonna try to show it here. The person doesn't have to bend all the way down. These muscles right here are really easy to get weak, so you want them to barely have to bend. So you always want to adjust the commode so they don't have to use those muscles too much. And contrary to popular belief, people are always like, but they have to use their muscles or they're gonna lose them. They have to work out, they should get PT. I hear you. And towards the end of life, it doesn't matter how much we work our muscles, our body is shutting down. So we need to preserve our energy. So thinking about trying to work out their muscles by getting them up and off of the commode is not what we want. We want to preserve their energy and make it as easy as possible to do tasks like that. We can provide walkers. So walkers are an important part of safety in the home. All of this equipment is a very, very important part of safety in the home. That is why we provide durable medical equipment, to keep the person safe. Because remember, I always say, is your loved one clean? Are they safe? Are they comfortable? When I say are they safe, this is what I mean. Do we have a house set up for their safety? A lot of times during my admission, this is the first thing I kind of start looking at. Where are they going to the bathroom? Where are they sleeping? What are they using to walk around? How well do they walk? Things like that. So a walker, although a lot of times people are very resistant to using one, can be very helpful. I love walkers much more than canes. I feel like canes can be a little unsteady, whereas walkers can really be a steady force. Now, I will say we do provide physical therapy on hospice. It's usually not to get the person stronger, but it's to help with equipment, help them learn how to walk safely with the walker, help them to learn how to safely get to the commode or transfer to the commode. It's also a way to teach their caregivers or their loved ones how to help them transfer to the commode so neither one of them is hurting themselves. We also provide wheelchairs. So wheelchairs to me are an important part of end of life. We want to preserve their walking as much as we can, but again, like I said, we don't want to overdo it. We want them to preserve their energy, and a wheelchair is a great way to get them up and out of the house, specifically if there's no stairs. So if there's no stairs, I'm always like, get them in the wheelchair, and if they want to go outside, get them outside, walk them around the neighborhood in the wheelchair, get them out to the store if they want to. So it's a great way to still have them live out their life and make it a little easier on them. And as far as walkers and wheelchairs, some hospice companies will provide different levels of wheelchairs. So like the standard wheelchair you're used to seeing. Then there's the lightweight transport wheelchair that has like the 4 small wheels versus the big wheel and two small wheels up front. Depending on the person's weight and size and the DME company, it depends on what they can and can't provide. Sometimes they'll be able to provide the wheelchair that slants back. That can help with people who have a hard time holding up their trunk. But again, it can be pretty basic on hospice, so not every hospice company will provide different specialized equipment, but some can and will. Oxygen. Something that is overutilized in hospice. Most people in hospice do not eat oxygen. Now, if they've come on with some kind of lung condition or heart condition and they've already been living on oxygen, yes, by all means, they should have oxygen. I'm okay, and most doctors are okay with like over ordering it because sometimes it can just be comforting to have the oxygen in the home just in case. But generally speaking, most patients don't need oxygen. They are just on it because this is something we've been doing for many years, so we just continue to do it. But oxygen is something that can be given through hospice DME. It's usually called an oxygen concentrator. I can put a little picture up here. It's like a box that you just plug in and that provides the oxygen. They usually do provide oxygen tanks as well, only if the electricity goes out. So you're usually not giving oxygen with an oxygen tank, you're using the concentrator. The Hoover Lift. Now, some people love the Hoover Lift. I'll also put a picture here. It's to help transfer patients from bed to chair, or if they're fully bedbound, it helps you like get them out of bed so you can change the bed and then put them back down in the bed. I do think it's a great machine to help with people who are fully bedbound and can't bear weight, to help their caregivers. To me, it is a little clunky. Like it's kind of hard to maneuver, but it's definitely something that's very useful at times. And as long as you know how to use it, it's very safe. So it's important to learn how to use it before you just start using it. And the hospice company can help you with that. Now, suction machines. Also a love-hate thing here on hospice, to me anyway. We do provide portable suction machines, so when people have like terminal secretions or if they have excess secretions, nothing to do with the death rattle, just for whatever reason their disease is causing them to have excess secretions, we can provide a suction machine, and it's a portable suction machine. I don't particularly like them because people will use them a lot for end-of-life secretions, terminal secretions, and it actually causes terminal secretions to get worse and cause more production of saliva. I usually try to educate people about why we don't want to use suction machines. However, if needed, we do have them. Those are the basic things we order for equipment for hospice. So let's talk about where we get them, who drops them off, who picks it up, things like that. We usually, a hospice company, will work with a DME company. So it's not our company, it's an outside company. That company, just like any company, has employees who have sick days and holidays, and so things can get mixed up where, we order the DME and a lot of times it can come that day or the next day. We can get it pretty quickly if we need to. And just depending on, who's working that day, if someone called out sick, sometimes we keep missing the DME company when they call to drop off the bed, or you weren't ready for the bed to be dropped off and now the bed is here. Things like that can happen a lot on hospice. And please know that that is normal. But please talk to your hospice company about, we've been having trouble with the DME company, or the DME company was great. The person who came in really explained everything to us. Please know that the people dropping off the DME equipment cannot touch your patient. If it's your loved one and you need them to get into the bed, the people working for the DME company cannot help you with that. They are allowed to set up the equipment, they can talk to you about the equipment, but they cannot help you transfer your loved one with the equipment. DME companies are amazing. Many times they can drop things off like that and it's all seamless, and every once in a while it's not that seamless and things can get screwed up, or they can't get a hold of you so they can't drop off the equipment. But either way, please just keep the hospice company in the loop so we can all work together and provide you with the best care. Once your loved one has died on hospice, that's another thing we have to do. We have to order the DME equipment to be picked up. Now, generally speaking, we're going to talk to the family about when they want that. Do they want it immediately? Do they want it the next day? Please hold off for a couple days because of X, Y, and Z. So we'll work with you and we'll work with the DME company. So generally speaking, again, we'll work with you, we'll work with the DME company to pick it up best we can when it's convenient for you. But it is usually pretty quick, I would say within a day or so. Also, there's certain equipment that we will not pick up, and it'll be yours to keep and do whatever you want with it. So like the bedside commode, we do not take back. The wheelchair we will take back. The bed we will take back. The suction machine we will take back. But like the walker, commode, we will not take back. Those will be yours to have. DME equipment isn't just practical. Now, it is practical and it's very helpful, but it isn't just that. It's about understanding and accepting the new realities of where your loved one is at and what you need to best care for them and to keep them safe. That is how I always try to work the conversation around why it's important that we have this equipment in the home. It's for safety. One of the number one things that can really take someone down, especially if you're elderly, is if you have a fall. And falls happen because the house is not safe. And it's not safe because there's not equipment to keep the person safe, right? So this is how I word it. This is how I talk to people about it. And it's about keeping your person safe while still allowing them to have their independence.